Hi, today I am going live with Dr. Mendoza, who is a chiropractor who has a specialty in perinatal care. And we're going to be talking all about perinatal care and how you can support pregnancy in a chiropractic and naturopathic sense. And I do actually have a lot of experience supporting pregnant women and actually working with fertility and infertility. And actually, this perinatal care has a special place in my heart because it was when I was pregnant that I actually decided that I wanted to be a natural doctor. And that is because I was dealing with a lot of issues during my pregnancy, including increased problems with my eczema and, just other issues that was really helped by naturopathic medicine. So, hi, Dr. Mendoza. How's everything
Hi,
doing? How are you doing today?
good. How are you?
Good. So I'm excited to talk about perinatal care. I know it's something that you focus on in your practice, and definitely in my practice, I deal with a lot of infertility, and then when those women get pregnant, I do support them through pregnancy as well too. So I wanted to just have a conversation today about how you support pregnant women through the perinatal period. And then also, I wanted to add, some things that I have found from a naturopathic sense that can be very helpful too. So tell me, where do you want to start with this conversation in perinatal care?
I guess I can just start with when they first walk through my door.
Yeah.
Um, Most women come to me, either women who have seen a chiropractor before, they usually will come at the beginning. When they find out they're pregnant, they schedule an appointment and come see me. And then other women will wait closer towards the end when they start feeling pain. And for those that wait a little bit later, I always remind them, okay, when you're ready for your second or third child, make sure that you start sooner than later, because during the time of pregnancy, your body changes so much, and we kind of have to like go with the flow of our pregnancy. And every time when something comes up, we know what to do. So I try to like prepare them before all those things like come, when I prepare them before they start having lower back pain. And so I tell them these are the things that you have to get. Um, so I always start with just checking their spine, talking to them about who their providers are, so that I can also co-manage their symptoms with like their MD or their OB or their naturopath. And then I check the spine because I want to see where they start. Like, do they have pelvic tilts? Because pelvic tilts makes a big difference in women who have pelvic pain or pubic pain when they're pregnant. Because if they already have a pretty bad tilt forward, so more weight puts more pressure onto the pubic bone, and then they start having pain that they say that they feel into the groin, or they start to weaken their pelvic floor muscle, and they start noticing that they're starting to leak a little bit more because of all the pressure onto their bladder. But that's where I start, and I always tell them that we're doing all this for prevention, and we're doing it so that our pelvis and how we're standing and how we're walking, how we're sleeping all makes sense, so that throughout the pregnancy we're not experiencing those severe pain. And women who do come in to see me at their second and third pregnancy says that it's a much better experience because they know what to do now. And then I teach them 8 basic exercises and stretches that they would do throughout the pregnancy, and it's to prepare them for the push. So the perineum, the muscle, they can be really tight, especially if it's your first pregnancy. So I teach them massages and some breathing techniques to relax that, so that when they do go into the delivery room, those muscles are very softened, and they're much more pliable. So when you're doing the push, it makes it much easier.
And do you suggest doing those right at the beginning in the first trimester, or do you usually start that in the second or even the third trimester?
Yeah, for all the stretches, I teach them that now. And all of the strengthening exercises to help the pelvic floor muscle, so that you don't have severe leaking after giving birth. So I teach that throughout the pregnancy at the very beginning. The parts where I have them doing the massages, that's towards the end. You want to wait until you're in your 35th week of pregnancy to do any of the massages, because you do not want to induce like early labor, right? And then I teach them another thing towards the very, very end, and that's at your 37th week, and that's called a perineal bulge, and that's just for us to connect to that muscle so we know how to push.
Okay, Cool. And if somebody wants to get pregnant, I think someone earlier said, she's excited to be here because she wants to get pregnant. Anything that they can do in preparation for being pregnant, even now, in terms of maybe even seeing someone like yourself right now to just get aligned and everything, so that when they're pregnant, that it can be a much easier, time.
Yeah, and with that, chiropractic is just a part of it. It's a small part, but in prepping to get pregnant, or if you're ready for an IVF or anything like that, it's good to have your pelvis in alignment, only because there's nerves that are coming out from your back, and it goes in and it controls the functions of your organs, right? And so you want to make sure that that's all intact, and that you are starting off with 100%, everything's cleared out. And so it makes it much easier for your body to accept a baby.
Okay. Yeah, I mean, definitely there's so many things I suggest in preparation for getting pregnant. And I usually suggest at least 3 months of preparation where you're just cleaning out your system, cleaning your diet, and really what I like to call your detox funnel, really cleaning out the detox funnel, because you're going to get pregnant so much easier if your system is clean and your organs are working well, and also if your body's in alignment. I mean, if just everything's working well, there won't be a problem with your body saying, okay, I'm ready to have a baby. So, I think preparation is really important if you're deciding that you want to have a baby. And so I think a detox is needed. And I think, I think getting your body also physically able, like exercising and stretching and doing those things, can be important too. Is there anything you can talk about in terms of like physical body alignment that people can do in preparation?
Well, I mean, as long as they're moving, as long as they're not stagnant, right? And I mean, there's no perfect body out there. It's just that you want to make it as optimal as possible. So when I talk about, if women are coming in, they really want to, have a baby, and they're like having, a little bit of problems doing it, I kind of evaluate like their lifestyle, and I do suggest sending them to all this different practitioners, such as yourself, right? But physically, I just tell them like how to decrease the amount of stress onto their bodies, and I could evaluate like how they're sleeping. They could be putting a lot of pressure onto the lower back, then creating a lot of pressure onto those nerves. And then we also talk about like their pelvic health. So if they have any previous conditions, we want to clear that out before they start the process.
Yeah, and you're talking about the nerves innervating that area. It can be important in housing that baby, right?
Yeah.
So it can be important in the fertility process as well too, is the pelvic health.
Yes. Yeah.
Yeah. Yeah. And so I think, if you do all that preparation, and what I like to call the detox funnel is cleared out and you're clean, oftentimes there won't be a lot of problems that occur during the pregnancy. And even like things like morning sickness, for example, that if if your liver is working well and your nutrients are good and your diet is really high in B vitamins and methylators, then you won't necessarily have morning sickness, which we think that like, oh, everyone's going to have morning sickness. But actually, if your system is really clean and moving, you shouldn't really necessarily have really bad morning sickness, or, it should be something that you can really get through. But in terms of naturopathic things for morning sickness, usually means that you might be low in B vitamins. And so B vitamins are good things to take, like B6. Also, there are things like peppermint and spearmint and ginger root. All of those can be really helpful for morning sickness. But usually if I can actually prep somebody for pregnancy, then they won't have these issues. And it must be kind of the same thing. If you prep your pelvic health and all that, then you won't have as many pelvic health, back pain, all those problems as the pregnancy progresses.
Yes. Yeah. And that's definitely true. I hear it more from my moms who've had like more than one child, and it's just because maybe the first one, they were really young and they're just like, oh, nothing will really hurt me. I can do this. I'm pretty strong, which they are. And then they bounce back much quicker than someone who's older. But when they get to their second baby, they just notice the difference. Like when I took care of my pelvis, when I took care of myself, when I had more times to relax, and I made sure that I did all the preparation for it, it was a much better experience. And even with the towards the end when you're delivering, they had a much better experience, and it wasn't hard for them, and they bounced back much quicker because they knew what to do, you know. But if you're a first-time mom and you come in and you get all that information, then we don't have to do all the hard stuff like during, but they already, you know, because in the beginning, if you start at your first trimester and you already know all the information, by the time you get to your third trimester and this is your first baby, you've basically became like an expert at it because you know exactly what to do before it happens.
Yeah. And I would imagine that proper alignment and everything will really help that labor progress really more easily, and that you won't get in terms of like, I mean, can you talk about like the labor pains, like even like, you know, the back pain and those things that happen? Do you notice that when you help the women you work with in their pelvic health or their alignment, that actually their labor and delivery goes better too? Like it's faster and they don't get these, you know, back pains, all these crazy things that might happen, and it actually will stop the labor from moving forward.
Yeah. Well, because you want to make sure, I mean, your pelvic floor muscle or your vaginal canal, it's not that like big, right? But when you are towards the end, you have all these hormones going through, which softens everything and makes it much more easy. But if you're out of alignment, let's say, you know, going back to like pelvic tilt, if you're tilted forward or backwards, if you're tilted forward, what I'll see is the stomach sticking out really far forward, and like you can't see your feet. And you can, if you look from the side of yourself in a mirror, you can see that your pelvis is way past your feet and your ankle. So that's an anterior pelvic tilt. So if I have muscles at the bottom, which is my pelvic floor, then I have bones, which is my pelvis. If it tilts forward or backwards in any way, it tightens, right? It tightens the bottom of the foundation, which is your pelvic floor muscle. So if you're tilted, you tighten that muscle. So when you're trying to deliver and push, first of all, your canal is not in the perfect position for a baby to come out, right? Because if I tilt this way, my canal becomes much smaller, or this way, it becomes smaller. But if I'm right in the middle, that means the baby's easier to descend down, right? So pelvic positioning and alignment makes a huge difference. And when women are coming in to see me, you know, at first they're like, I can't see my feet, but when all I do is fix their posture, they're like, I can see my feet. And
yeah,
it's just because of like how tilted.
Even with a big belly, they should be able to see their feet.
I mean, actually, I mean, it depends on the woman, right? Like if they, how big they are. So if you just have a lot of baby, then you're probably not going to see your feet, but you can see it better than before, because before you were so tilted forward. Yeah.
Yeah. Okay. I see that a lot. And then I see, you know, women going like this, and like their bellies just sticking out, and they're holding their backs, and okay. Yeah.
So, and then in besides like just adjusting them and making sure they're in good alignment, I also suggest wearing a belt towards the end. And that's not every woman wants to wear a belt, which is fine, but the belt is just to help pull your belly closer to your body so you don't have so much of that tilt forward, because a tilt forward can cause you to have your pubic pain, and they also cause tailbone pain. And for women who don't feel that during the pregnancy, they will complain about it at the end. Like after giving birth, they're like, my tailbone hurts, and it's just because of now you don't have that weight pulling you forward anymore, but now your pelvis is shifted because you've held it like this for 9 months, and so trying to sit down comfortably becomes painful. That's another very common symptom that I have with my women who are coming in and they just had a baby, and they'll have like it feels like it's like going right into them when they're sitting down, and so they have to either sit forward or sit backwards, and that's the only way to relieve that pain. But I mean, how can you do that? You know, like how can you like have to like change the way you're sitting and not sitting comfortably? And some of them will start using what are those, the donuts that you have him, so they start using that. Yeah, I've had so many women come in and they say that they carry that pillow with them everywhere because they can't sit down anymore, and they didn't have the pain during pregnancy, it happened afterwards.
Okay.
So it's important to be aligned during pregnancy, before pregnancy, and after.
So tell me about the trauma of birth and delivery, and how, like afterwards, how can you work with the pelvic health to improve it so that you don't have problems like that?
So I think that it's important that every woman who has given birth, sees some type of therapist, whether that's a chiropractor that does this type of work, which is what I do, or a physical therapist who specializes in postpartum care. And as soon as your doctor says it's okay to go at like your 6-week appointment or 8-week appointment, you should start some type of routine to basically retrain your body. Because during pregnancy, not only does your posture change, but your muscles start to change, right? And then there should be, there's some muscles that are overcompensating while other muscles are weak. So if your pelvic floor muscle is weak from giving birth and you're pushing this baby out through the canal, then the other muscles have to work harder to keep everything stable, right? And so if you saw somebody after delivery, then they can start focusing on how do we, retrain the pelvic floor. And so they'll teach you very simple exercises. It's going to feel like a Kegel, but it's not a Kegel, because what we're trying to do is we're trying to retrain a muscle. So we want to do a slow contraction instead of like a hard contraction like a Kegel. And we'll also be learning pelvic floor contractions with exercises. So if you want to go back to CrossFit or lifting weights again, you always want to make sure that you retrain that muscle, because if you don't and you go and like just lift heavy and your pelvic floor muscle hasn't even been retrained yet, you're going to end up causing yourself leakage, which is leaking of urine, and you can't hold your bowel movements anymore. Now, this doesn't happen to everyone, but it does happen. And so I always try to tell or prep them before they get to that point where now they're like, okay, I can't cough or sneeze or jump. I can't even exercise anymore because I'm leaking. So I always prep them before they actually go into the gym. So it will take maybe about like, for some women, it's much quicker. So it takes them like 8 weeks and they're like, I'm ready. I can start lifting again. And other women, it may take them a lot longer. It just depends on how much time they have to like work on all of this.
Okay. And then kind of going back to the pregnancy, what would you say is kind of some helpful tips for exercising during pregnancy?
So during pregnancy, because our deep core muscles are transverse abdominis muscle, right? And that muscles, they pull away from each other because you have this growing baby inside your belly. So when women are continuing to exercise, which I recommend that. I mean, if you're exercising, you're active during your pregnancy, it makes it so much easier to deliver that baby towards the end, right? And so I always try to say, so I tell them just to work out, but be careful about doing certain things like crunches or planks. The reason why I say that is because you have to think of your transverse abdominis muscle like a zipper. And so if I put weight on top of a zipper, it's gonna slowly unravel. And so if you're in a plank position with this belly that's probably like 10 pounds because of all the liquid in there, then you're gonna separate that a little bit more. And so we want to take care of that. We want to make sure that we don't separate it as much, because after giving birth, that separation could stay open. And so some women will have something called diastasis recti, and it's that separation of that area. It's normal to have separation. Everyone's going to have a little bit of separation. For some, because they didn't take care of themselves because they were doing sit-ups or core work, it's a little bit further. And if you're a little bit further, then it's going to take a little bit more time for you to recover. But women who take care of that area and prevent so much of that doming, then they'll recover much quicker towards the end.
Okay. All right. Someone's asking a question, a waist trainer. Do you recommend a waist trainer?
So not a waist trainer. You can get something, it's like a like postpartum pregnancy belt for, because I know that there's something that are waist trainers are binders, right? But after giving birth, like you don't want to put that much pressure onto your organs because you've had this baby that's pushed organs to the side, right? And you don't want to put that much pressure because you don't want them to sit in different position when they're too tight. So I never suggest a waist trainer, but a postpartum retraining of your core. There's one company that I really love. They sell those postpartum belts, and you wear it when you're breastfeeding or when you're pumping or when you're exercising. And it's just to keep everything kind of tucked in. but it's not going to feel like a waist trainer. It's very gentle and soft. I purchased it from a company called bellysinc.com, and you can go there on their website at bellysinc.com, and it's this huge like postpartum belt where it should cover from the underneath your rib all the way down to the top of your pubic bone. So it covers, because your transverse abdominis muscle starts from underneath your rib all the way down to the pubic bone. And so you want to make sure that you support that when you are lifting your baby out of the crib, or when you're exercising, or when you're breastfeeding, because when you're breastfeeding, your abdominal muscle starts to pump, right? And so you want to make sure that you support it while it's doing that. And it helps to heal that area, but it also helps to reduce some of that. For some women after giving birth, they have a little bit more of a bulge in their stomach. So even, you know, after 6 months or a year, they still have that bulge, and it's because of that separation of their transverse abdominis. And so we want to make sure that they come together in the beginning, because it makes it so much easier, because your kids are going to get older, they're going to be heavier, you're going to lift them. And the heavier that you have to lift something or an object, that means that the more separation you have in your abdominal muscle. So you want to take care of that in the first 6 months after delivery.
And now, are you wearing that all the time? Is that
No.
like, okay, so only when you're doing lifting or breastfeeding or things like that? Okay.
Yeah.
Right.
I'll have someone wear it if they know that they're going to be carrying their baby while they're walking. They can wear it, but you're not going to wear it all the time. You're not going to wear it sleeping. You're not going to wear it if you're just watching TV. Only wear it when you're active, because
when you're kind of being active and doing
yeah.
That. Okay. All right. And then how long did you suggest that you keep that, using that for how long postpartum?
Well, as soon as they feel comfortable, they're not feeling the weakness there anymore, and they start noticing that everything's starting to flatten out, then you don't have to wear it anymore. It's just during when you're healing and you're rehabbing, which rehab usually will take about 8 weeks to more, depending on your body.
Okay. Okay. And then is that the same place that you get the one that you use at the end of the pregnancy? How you were saying to kind of keep it in and protect your back?
Yeah.
That's belly
so there's
too.
Yeah. So there's one where, well, actually the one that you would wear during pregnancy, it's a, what is it called? It's a sacroiliac belt. So SI joint belt, and you should purchase one for pregnancy, and that's going to look different than the one I was talking about at Belly's Inc. The one that you can purchase, you can actually get this on Amazon, and you just want to look for pregnancy support belt. So if you look at pregnancy support belt during pregnancy, then it's like a smaller belt, and you only put it underneath the belly and around your back. And sometimes it has like a strap that goes across your upper belly. So that's what you'd wear during pregnancy. For postpartum, it covers your whole entire belly, and that's a postpartum belt instead of a pregnancy belt. Yeah.
Okay.
Yeah.
Someone was asking if you have a recommendation for a sleep pillow during pregnancy.
Oh my gosh, those are really hard. There's so many different pillows out there. I just, I used a pillow that I bought from Target, and it was like a king size pillow because it was perfect enough for me, where I was able to hug it from the top and on the bottom. So any pillow works as long as you can, like tuck it underneath your belly, or you put it between your legs, or in between your neck and your shoulder. If you can find a pillow that fits, I just say use whatever, because those pregnancy pillows can be a little bit expensive, and it doesn't always fit everyone's body type. So I would just say, borrow one if you can from a friend, or wash it first, and then you can use that, because it can be really expensive. Or just go to Target and purchase one of those long pillows.
Yeah, and I think I found when I was pregnant, I bought the pregnancy pillow, and then I just didn't use it. It didn't fit me well, so I just took a bunch of pillows and put it in, where it felt. And I guess what you want to think about when you sleep, though, right, is the alignment. And can you tell us a little bit about that, like where your neck should be, and how do you know that you're well aligned when you're sleeping? And obviously, as you get bigger, you're going to be sleeping on your side.
Yeah. So when you're sleeping on your side, you want to just make sure that your nose and your chin and your sternum, like the middle of your chest, is in one line. So if you notice that you're sleeping on your side and your head does this, then the pillow, and this is your bed on this side, then the pillow's too small or the pillow's too big if your head's doing this, right? And this is like the mattress. So you want to just make sure this whole area right here is in one line, because as you're standing, that's in the middle, and that should be straight. So you want to do the same thing to support that when you're on your side. Now, when you get later on to your pregnancy, your belly is going to get bigger and it's going to kind of sag to the side that you're sleeping on. So for those, I say put a small little pillow, like one of your really old, thin pillows that you don't use anymore, tuck it underneath your belly, and that's going to help because it'll help keep the weight in the middle, and you won't end up having like that pain towards the side that you're always sleeping on, that your belly's sinking towards.
Yeah. So, and I think someone was asking, there's C-shaped pillows and U-shaped pillows. And so what I was saying is that I bought that C-shaped pillow, and I actually ended up not using it just because I didn't feel like it fit me properly. Yep. So I just, like you're saying, like I just tucked a pillow under here and I made this pillow right for my alignment. And I think that worked better actually. Than buying the big pillow that you also have nowhere to put it because it's huge.
Yes.
So, yeah.
You have to share the bed, and it's gonna feel like there's 3 people in this one.
You're gonna get kicked out of the bed. Yeah. Someone was asking about planks and sit-ups during the first trimester. Is that something that you would suggest?
If it's something that you've been doing for a long time, yeah, you can definitely still do them. It's when you start feeling that your belly's growing a lot heavier, or if you notice a dome. So when we do a crunch, our belly's more rounded, but if you start seeing a doming like this or like this, then that's when you probably shouldn't be doing them anymore. But if you've never done crunches or planks and you're pregnant, then I wouldn't suggest you start. You can definitely do them while you're pregnant in the beginning. I usually say maybe at the second trimester in the middle to stop doing those.
Yeah. I don't know if you know, but when I was pregnant, I created a fitness DVD because I was a professional dancer back then, and it's called Mommy Shape. But I used to say that, if you're used to doing it, if your body's used to doing that type of workout, you can probably continue it. One of the things that you want to check is that, but also, you also don't want to push yourself too hard. Like if you're the type of person that exercises till you're like stressed out, you don't really want to do that when you're pregnant. But you can still work out hard if you're used to working out hard. But I usually say like you shouldn't be out of breath, because then, you're going to be losing oxygen and blood flow and all that. But you should be able to like talk, but not sing. Like if you can sing, you're probably not working out hard enough. Yeah. And if you're out of breath, you're probably working out too hard, and we don't want you to stress your body out when you're working out while you're pregnant.
Yep.
Great. And so what are these other things you wanted to mention? So episiotomy, how do we, did you go over that already in terms of how you can prevent an episiotomy?
So yeah, that's about keeping that tissue, your perineum, which is the muscle that connects your vaginal opening to your anal opening. So that space right there, that's like your perineum. And that's usually what is cut when it's too tight, right? When the baby's head stuck, or you can't push because it's so tight in there. So sometimes, I don't know if doctors are doing this as often anymore, but they used to cut that tissue. And if you're cutting, it's much harder to heal from than if it rips on its own, because your muscles are connected in a more, it's not just linear, it's kind of like wiggly. And so if you had a natural tear, you'll heal much quicker. But if you have like a straight cut, then the tissue fibers are all, like all cut open. And so it's much harder to heal from that. And so towards the end, at your 35th week, I have my moms do this massage that they do every night. And they spend about 3 to 10 minutes a night doing it. And having your partner help you might be a little bit easier. Because they can put pressure, and the more that they work on it, the better that they become at knowing how much pressure to put onto you. And they can help during when you're at the hospital, when you're about to give birth. You can also do this during that time too, to help prep it right before the doctor has to make that choice to cut it. And so if you do these and then at any time, like if before any exercising, any of this like massaging stuff, you always want to make sure that you talk to your doctor first, because there's certain conditions that you don't want to do these things with, because it gives you a higher risk of having a problem happen. And so make sure that you talk to your doctors before you start. But the massage, You can find a bunch of YouTube videos. I made my own video that I give to patients, but you can find them all throughout YouTube. Just look for perineal massage, and they show you how to do it with your partner, or, you know, by yourself. But if I were to show everyone in here on how to do it, if this is like the vaginal opening and this is your perineum, the muscle here, you want to just put a thumb down and into it. And so you put about like 1.5 inches, or an inch or 1.5 inches into the canal, and you put firm pressure down, and then you create a U to massage the other spots. And you do this very like slowly and gently, and you might feel a little bit of like a tingling, and sometimes it goes a little bit of numb, like goes numb a bit, but that's normal. What you don't want is excruciating pain or redness to happen or swelling. That means that you like it's too sensitive there, or you're putting too much pressure.
Okay. Yeah, that's great advice. And I think, so, you know, just avoiding the episiotomy in general and doing that massage and then allowing it to tear if it tears.
Yeah.
Which it will heal, and things will be okay. And then I usually have patients. I don't know what you do for healing, but I usually have patients prep a bunch of just like pads, and I have them put witch hazel and is it chamomile onto the pads, and I have them put them in the freezer so that when they get out and they just had their baby, they can take those out of the freezer and just put it on. And it actually feels really good, and it will actually heal any tears. And if you had to get stitches and all that, it actually heals, and it feels really good. It's calming, and then it will astringe that area so that it can heal up really nicely. So that's what I usually. Yeah. And it feels good. It feels like really good because, you know, at that time it's very sore in that area. So
yeah.
And then you had mentioned that you want to talk about just muscle relaxation during the labor, and what you would do kind of to prep for the labor or during the labor. You had mentioned something about that.
So like prepping the breathing part, is that what you're talking about?
Breathing, and then you mentioned like muscle relaxation, even during labor and all that. Well, what do you normally suggest there for kind of preparation for the labor? Like especially if you're going to have a natural delivery and you're not going to use any, you know, any meds at all. Do you have any suggestions there for prepping?
Yeah, so I usually will have women go into the position that they're going to give birth. So whether that's on your back or on all fours, or in a squatting position, because those are like the suggested positions, especially if you're also giving birth at home. Like a squatting position is much easier. And so I usually will have women go into their position that they think that they're going to give birth. So let's say it's a like on all fours, right? So if they're on all fours, I have them doing breathing, like the cat-cow breathing. And so as you're breathing in, they're going to relax that pelvic floor muscle, which is your perineum. And when they're breathing out, just resting, and then breathing in again and relaxing that muscle again, and like really feeling it. So it's going to feel kind of like when you're going past relaxation, you end up putting pressure onto the pelvic floor muscle, and it's going to feel like you're trying to pass gas. So that muscle that you activate or you relax when you're trying to pass gas is your pelvic floor muscle. And so if you're going to give birth on all fours or in the squatting position, I have like if you're squatting, I have women go in the squatting position, and in that position they're taking a deep breath in and they're relaxing that pelvic floor muscle, or just slightly passing gas a bit to know what it feels like, and then they breathe out and then relax. And this will help them during when they have to push.
Interesting. Okay. Yeah, I've never actually heard of that, the prep for the push. I think that's a really good idea.
Yeah, and then you just practice it towards the end, like around your 35th to 37th week out. You want to practice during that time, because it's just more like learning how to connect to that muscle and then being able to relax, so that when you're going to give birth, that's when you're going to, you know exactly what to do.
Yeah, that's great. So anything else that you can think of perinatal care that you would like to talk about or give suggestions to for anybody who's listening here who's either wanting to get pregnant, currently pregnant, or maybe was pregnant like a long time ago and still has all this pain from the pregnancy?
I would suggest, if you are having pain now, or and you're pregnant, then to go see somebody to help them just kind of manage that, because if you start having pain already, it's really hard to get rid of it completely, right? Some women are very lucky and you can do that, but for most, it's just more of like how to manage it, right? So that you're more comfortable, so that when you are going into delivery, that it's a much more it's a better experience than all this like tightness and like pain. But it's all about managing it during the time. Now, if you are having all the pain now and you've already given birth and it's like, 10 years ago, and every time you've gone to somebody, they just can't figure it out, you may want them to look at your pelvic floor muscle, because if you've had a tear somewhere, anytime you sew up a tear, it's going to be an area that feels tighter. And so if it's tighter, then it's going to pull and create like all this misalignment in your pelvis. And so you have to find it. You actually have to go and find the root cause, because everyone else may just be treating your back. So if you go in and you're like, I have back pain, they may just be treating your back and that's it, and they're not looking at anything else. So you want to figure out what the root cause is. And if you've had a baby 10 years ago and you're still having pain, then it might be something that's internally and you can't see it. So you would see an internal pelvic floor specialist and they would work on the inside.
Yeah. Somebody's asking, how can they find prenatal chiropractic support near them? Well, Dr. Mendoza practices here in the Bay Area. So if you're in the Bay Area, I would highly suggest you go see her, because I think it is important to see a chiropractor who specializes or knows a lot, at least, about perinatal care, because I do think being pregnant and dealing with pregnant women as your patients is a totally different, I think it's a totally different, even as a naturopathic doctor, there's things that I need to know that's very different from treating a woman who's not pregnant. So I highly suggest you find someone like Dr. Mendoza. So if you're in the Bay Area, definitely reach out and we'll get your information in a second. But is there a way, like an association where there's prenatal chiropractors or that people can find?
Yeah, so if you find a doctor that works with pediatrics, and you can just Google it. If you just Google pediatric or prenatal chiropractic care, look for, because they usually will have an area that says that they certify in different things. Look for someone who's certified in Webster technique, and someone who's certified with Herman and Wallace. So those two names, so Webster technique and Herman and Wallace, are the two things that we have to do to be certified in working with perinatal and postnatal care. So if you just look for those things in their description of their About Me part, then those are usually the ones who have gone through extra schooling afterwards and know about this.
Okay, great. And then where can we find you? So for those of you who are listening who are in the Bay Area, where do you practice in the Bay Area, and what's your website, and how can they contact you?
I practice in San Mateo, and I have a website that you can find the information on there, but it's BeFreeLiveWell.com, and then you can contact me at Dr. Narath at BeFreeLiveWell.com.
Great. And I will also, tag you on this live that I'm going to post when we get off. And so you guys can also follow her and reach out to her there as well, too, on your Instagram as well, too. Yeah. Great. So, I think this is a great conversation. And we are going to actually be talking next week. Dr. Mendoza, what are we covering next week? Can you remind me?
So next week, so today was about perinatal, like what to do when you're while you're pregnant, and then next week we're going to talk about the postpartum care part of it. And so we'll talk about how to wear it, how to wear the belt, and what to do with the belt on. So we'll do that, and then we also have a third one. So if you know any men who want to come on and hear us, we're going to be talking about men and pelvic health, and how to take care of like pain that they may feel, and which is related to the pelvic floor.
Yeah. So we're going to do these, every Wednesday for the next 2 Wednesdays, and they'll be at 12:30 Pacific Standard Time. And so next week we will be just talking about postpartum, but also women in general too, right? Yes. Women with pain, and I guess even if you haven't had a baby, I think it can be applicable to you too. So if you know anyone who might be interested in that, you can have them join our live. Well, thank you, Dr. Mendoza, so much for
thank you for having
conversation, and I look forward to continuing this conversation next week.
All right.
All
Thank you.
right. Have a great day. Bye,
Bye.
everyone.